It's usually not just one symptom. So that's one very important thing
Yeah.
to think about. I'm not Shoemaker trained, but Dr. Shoemaker talks about it as a cluster.
Mm,
Some super common ones,
yeah.
but unfortunately are common with lots of other things, is fatigue. Fatigue
Mhm.
is very, very common. Dr. Joseph Brewer did a study here on chronic fatigue syndrome patients and those with fibromyalgia and chronic fatigue. And they found mold mycotoxins in the nasal washing of about 93% of those people. So
Wow.
we know fatigue is a really important part of this picture. Also brain fog.
Mm,
And if you think about it, it kind of makes sense. Like we get alcohol from fermented yeast. So when happily living mold is growing in your environment, it's off-gassing alcohol. So you're actually breathing air and getting drunk. And visual symptoms or system is very affected, not just the bioflavonoids in the retina because of bile. There's this whole complicated thing that happens with bile in the retina of our eye, but also just the visual processing center of the brain, just like if you've had a drink. I think
mhm,
that's why we don't drive when we're drinking because you don't see quickly. Things take a little while to kind of process in the brain. And that's that's a really common thing that we see with mold. We almost always see something gut disruption. So that's going to be whatever Achilles heel direction, if it's going to be diarrhea or constipation, or a lot of my patients, they had what one of my patients called constaria. Like, he
mm,
wouldn't go, and all of a sudden just flush, and he would feel exhausted afterwards. Um, Gut inflammation, food sensitivities, losing foods. You might, little by little be dropping foods out of like, oh, it's funny. I don't really tolerate garlic anymore. And
mm,
that's super common. Not tolerating fermented foods, not tolerating carbohydrates. And so people really love the paleo diet because that's like the keto paleo combination. They're really drawn to it. It's because it's helping to monitor or knock down the fungal overgrowth in their
mhm.
gut. We see some skin changes. Again, that's going to be your Achilles heel. If you're more prone to acne or psoriasis or rosacea, you'll see more inflammation, eczema, those sort of things. If you're more prone toward aging, you're going to see skin wrinkling, age spots, that kind of thing. So it's oxidative damage with inflammation. It's going to show up on the
Mhm.
skin. We also see a lot of urinary frequency and urinary
Yeah.
symptoms, people
And
that feel like they have a
why is
bladder
that?
infection. Couple of things. The
Yeah.
mycotoxins, thinking about the path of the mycotoxin is that's why you get gut disruption because one path is the liver, bile to the gut. The other path is kidney to the bladder.
Mhm.
And the kidneys don't detoxify, they just clean. So those mycotoxins will concentrate in the urine. And when they're there, they're bumping into the bladder wall, and that causes ulceration, irritation of the bladder wall. So you literally feel like you have a bladder infection because there's irritation and urgency. And so there's that. But also, the body, the way the mycotoxins affect the brain, it affects the manufacture of ADH or antidiuretic hormone,
Mm.
which means that water takes the fast track through your body. So you can be drinking water and all my mold patients will say, I can't drink anything until, because if they know they're going to come for a urine test, they're
Yeah.
like, no, I'll drink something in the waiting room because I'll have to pee right away.
Mm.
And doctors, I was trained, that's not possible. But when you've been sick from mold and you don't have this hormone, that's possible. People can drink a cup of water and they can pee 700 milliliters in 10
Mm.
minutes.
Yeah.
So that hormone is really important to optimize.